It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
And welcome to UofL Today with Mark Hebert on 93.9 The Ville. This is the show that's about all the great stuff going on at the University of Louisville, including the research, the programming, and all the great students we have at UofL. So that's what we talk about for the next half hour or so. So what's on the show today? Using data, we can figure out the most likely homes with children in them that will have fires. It's true. A UofL biostatistician will be here to talk about his study, as well as an app to keep track of your hand washing, especially in hospitals. But first, Better Health Together. That's a monthly segment brought to you by UofL's partners at Passport Health Plan. Passport is a nonprofit managed care organization that's been administering Medicaid benefits in Kentucky for more than 20 years, and they've been a partner with UofL for those 20 years. Majority of Passport's members are right here in the Louisville area, and that is where we are having a Hepatitis A outbreak. So what is Hepatitis A? How big is the outbreak? How could it affect your health? And do you really need to be vaccinated? Sarah Moyer is the director of the Louisville Metro Department of Public Health, the chief health strategist for our city. She's also an assistant professor in the UofL School of Public Health and Information Sciences. Boy, that's a long title, Sarah. You know that?
It is.
Very
both
lengthy.
Both of them really long. Louisville Metro Department of Public Health and Wellness,
and then the
School of Public Health.
School of Public Health and Information Sciences. That's a bunch. So you've been in Louisville for 5 years now. Mm-hmm. And you're the chief cheese at the Metro Health Department, right?
Yes.
The big cheese. All right, we've got this Hepatitis A outbreak that everybody's talking about it, and it's on top of mind for a lot of people. We've heard a lot of news about it. What is Hepatitis A? Let's start with the basics. What is Hepatitis A?
Hepatitis A is a liver virus. It is transmitted what we call fecal orally. So it's when someone who uses the bathroom doesn't wash his hands great, or her, and has a small amount of fecal matter still in her hands, and then that touches something that then goes into your mouth, whether it's preparing food or a cigarette, anything that would then go into your mouth, and that's how you ingest the virus and get it.
And if I get Hepatitis A, what's going to happen to me?
You get really tired, you turn yellow, diarrhea, feel kind of like you feel the flu, like you have the flu, but you also turn yellow.
Okay. Can it kill me?
It can. So we've had one death so far in this outbreak. Mostly people tend to get more sick are the ones that have other health problems to start with. But it is, otherwise it's self-limiting. Once you have it, you're immune to it forever, and you can't catch it again.
All
so
right.
It clears. Unlike, there's been a lot of confusion because we have hepatitis B and hepatitis C as well too, and both of those are transmitted through blood, and so those are more common among people who inject drugs. So like that's one of our greatest risk factors for those two, which is different than hepatitis A, is where you eat it to get it.
Now, we're recording this show just before Derby Day, and it will air right after Derby Day, but you are making plans for the Derby weekend as we sit here. It's coming up. To try and make sure that we don't have an even bigger outbreak from all these folks coming into town. So what is the health department doing and UofL doing to try and mitigate that?
Yeah, so the outbreak was declared officially back in November. And so since then, we've been pushing really hard to vaccinate in our two high-risk groups, which are the homeless, or people who have unstable housing, and then also people who use drugs. Not just injection drugs, like I said, because you eat it.
Right.
So any kind of drug, sharing marijuana, sharing a cigarette. So we're really been trying to vaccinate people in those two groups. And we started that in November with sites all across the community. With the epidemic growing, there's some risk of it being transmitted through food. We've had a bunch of cases in the community in food workers. We haven't had any cases connected to those food workers yet, so it's still mostly just in those two high-risk groups. But with Derby and everyone coming to town, back in March, we really started pushing that all food handlers get vaccinated because, as you've seen, every time we have a case in a food worker, we have to notify the public just so they're watching for symptoms, and we don't want to have to do that internationally. And so we did a big vaccination event before Thunder, vaccinating all the food truck workers, and then same thing with Derby. We vaccinated everyone during orientation, so hopefully at least the food workers are vaccinated to help prevent the transmission.
Again, we're talking with Sarah Moyer, who's the director of the Louisville Metro Department of Public Health, the chief health strategist for our city, and she's an assistant professor in the UofL School of Public Health and Information Sciences. And this segment's brought to you by Passport Health Plan. Better health together with Passport, working to improve the health and quality of life for its members. A couple of things you just mentioned that you talked about that I think are really important. One was that you said that there haven't been any cases of hepatitis A tied to patrons or people that went into these restaurants where workers had hepatitis A, correct?
Correct.
Okay. Does that surprise you?
No, this outbreak, so anyone who's been around since, I think 1988 was the last big hepatitis outbreak in Louisville. And that one was a little bit different than this one, where it was connected to lettuce, to the food. So everyone who ate at those restaurants got hepatitis. And this was before the vaccine. So we were able to stop the spread just with hand washing. We're able to stop the transmission from person to person. This one's a little bit different. It's in different risk groups, like two groups of people who have less access to hand washing, less access to the healthcare system, and so less likely to be vaccinated, hand washing, and so that's why it's spreading so fast and it's larger than our 1988 outbreak. But as long as we're following proper food code, we've got great food code laws. I've got great restaurant inspectors on my team at the health department that are inspecting restaurants, make sure they're washing their hands, using gloves. If they're following all those proper measures, there's very, 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 very small chance you can get it from a restaurant, even if they have hepatitis A.
So why then does the health department put out the warnings to everybody and say, this worker at this restaurant has hepatitis A? Why do you have to do that? Is that required by federal law or something?
Yeah, it's standard, and also just because the chance isn't zero, we need to let people know that there is a chance and to watch for symptoms so that if someone does come down with it, they can see their healthcare provider and get treatment earlier and increase chances of having a better outcome.
And does it also provide you with information to be able to track it in case you do have some folks that all ate at, I don't know, what was one of the restaurants where one worker came down and said, they all ate at the White Castle or the Chili's or wherever, where we had one worker, that you can track that a little easier?
Yes.
People think, oh, yeah, I ate there last week.
I did eat there last week.
Yeah. Okay.
But we've been getting a lot of people who think they got it from restaurants or places too, but the chance is very, very small. But we notified to just so people are prepared. They can get vaccinated if they're not already vaccinated, and just protect themselves.
What role is the University of Louisville infectious disease folks? What role are they playing in these vaccinations and in this outbreak?
They've been a huge partner, especially the University of Louisville Global Health Center. Dr. Ruth Carrico and her team have teamed up with us to provide reduced cost vaccinations to all the food workers in Louisville. And so her team and all the volunteer nurses and medical students and everyone with them have been helping us to vaccinate all the restaurants in town. And they've done over 60 different restaurants. Thousands of people have taken advantage of this reduced cost vaccine and been vaccinated. And we couldn't have done that without their help. And
the vaccine lasts how long?
It's it's a 2-shot series. One shot gives you close to 100% protection, and research shows it lasts about 10 years. If you want lifelong protection, you need another shot 6 months later.
So these restaurant owners, mostly fast food folks, I assume, that are coming in and having all their employees vaccinated, that's good for 10 years.
That's good. So really for this outbreak, we're really just encouraging people just to get one vaccine. That's good.
Wow. And so, that's the good news for everybody else is, food service workers go from one place to another, but they're going to be covered, and presumably it'll cut the chances of having another outbreak in the future, won't it?
Yeah, definitely. And we're lucky too. So the state of Kentucky has been requiring all kids to be vaccinated for school starting this summer. And so 20 years from now, this isn't going to be an issue because all our kids are going to be vaccinated. Everyone's going to be vaccinated, and we won't be sitting here talking about hepatitis A. It'll be some new disease that's out there that we'll be talking about. But yeah.
The segment is called Better Health Together, sponsored by Passport Health Plan, who's been a partner with the University of Louisville for about 20 years now. They are a managed care organization that's been administering Medicaid benefits in Kentucky for more than 20 years. And we're talking with Sarah Moyer, who is the head of the Louisville Metro Department of Public Health and also an assistant professor at the University of Louisville. On the hepatitis A vaccinations, should I get one? I'm not a food service worker. I'm not an at-risk person. Should I get one, and why?
Yeah, if you haven't been vaccinated yet, we're recommending everybody see their healthcare provider or pharmacist to get vaccinated. It's the Department of Public Health statewide have recommended everybody in Jefferson County get vaccinated probably about a month ago now, and we're just really pushing that message and encouraging because we don't know. Right now, it's still mostly in those two high-risk groups, and so if you're
which was the what, homeless and
people who use drugs,
okay,
and that's any drugs. It's not just injection drugs. So definitely if you're in those two groups, and definitely if you have any sort of liver problems, other health problems, recommend 100%, and then encouraging anyone else who wants to get vaccinated, especially if they live in Jefferson County, to be vaccinated.
Now, in the past, this has been spread by gay men as well, correct? Has that become a problem in Louisville with this outbreak that we've had?
Not with this current strain of the outbreak, but other outbreaks, there's a different, so hepatitis A has many different strands. So there's a different strand that's going around the MSM community. We haven't seen a big outbreak of that here in Louisville, but we are still encouraging everyone who's in that risk category to also get vaccinated.
And the bottom line for everybody out there is just wash your hands more, isn't it?
Wash your hands, yeah. So washing your hands is how you prevent it and prevent the spread. If your hands are clean and the food you eat is clean, there's very small chance of getting the virus.
What about hand sanitizer? Does it work?
It's not as effective as just soap and water. You have to have a really high level of alcohol and use a lot of it. And so we're just pushing soap and water. That's really the best way to get the virus off your hands.
A lot of people might have a high level of alcohol, just not on their hands.
Yeah. Yes. So in that case, get vaccinated if you haven't already, and wash your hands.
Any special places in town right now here in the next couple of weeks that people can go to get vaccination if they don't want to go to their doctors or they want to check and see if their insurance covers it? Any place that we get the reduced priced vaccinations?
So it's the hepatitis A vaccine falls under the preventative services of your insurance. So by law, it's required to be covered without any deductibles or copays. And so depending on your insurance, they want you to go different places. Most insurance plans you can get at your pharmacy or your healthcare provider, and it should be free. So go to your local pharmacy. Almost all of them are giving them out. If the one you go to doesn't happen to, try the one next door. But all the Walgreens, CVS, Walmarts, Kroger,
every place that offers vaccinations for anything else are offering it for hepatitis A.
Campus Health is giving it out, so if any students aren't vaccinated yet, they can make an appointment and go there as well.
Maybe I need to run down there. I haven't had my vaccination.
Yeah, I don't know what the rules are.
I know what they are.
Students, so I'll let you figure that one out.
Gotcha. Again, we're talking with Sarah Moyer, who is the director of Louisville's Metro Department of Public Health and also an assistant professor at the University of Louisville. Well, let's talk about some other things that the health department does. I think most folks know about the restaurant inspections. Does that go hand in hand at all with the hepatitis A outbreak?
Yes, it does. I mean, I think our inspections, that's why we have them there, is just making sure restaurants are following proper food code, they're washing their hands, they have food stored properly, they're using gloves. And so I think that goes hand in hand with why we haven't had cases connected to the restaurant hepatitis cases yet. And so it's a really important thing we do. We have extra food workers out on Derby and all the events, just making sure people are still following code, making sure everyone is licensed, and so really encouraging not having the mom and pop food sale going on in the corner, all that. We're just ensuring people are going through licensed places and they're following proper code and preventing the spread.
What else does the health department do that we should be aware of that impacts Joe Schmo public in Jefferson County every day?
Mosquito control. Mosquito season starting here soon, so we'll be out doing some pre-treatment just in all the catch basins, preventing mosquitoes from being born. We monitor that all summer.
Can you come to my yard?
Yeah.
In my bushes?
If you have too many mosquitoes, well, make sure there's no standing water because they breed in just a quarter-size amount of water, and then call us if there's too much because we monitor that and do spraying if we need to.
Right, but it's mainly in neighborhoods that have standing water out in the streets along the roadways, correct?
Kids' toys in the backyard would be what I'm guilty of.
Okay.
So
yeah, I got
all
you.
that. Yep.
All
Bird baths, all that.
What else you got coming down the pike?
We are doing a lot of work on health equity. We just released our 2017 health equity report last fall. It really maps out what we call social determinants of health or root causes, where they are in the city, where we have different health outcomes, and really great call to actions of what we can do to help improve that citywide. There's a 12.6 gap in life expectancy if you travel across the city, and we're really working on trying to close that.
Okay. And lastly, tell me about the relationship between the Metro Health Department and the University of Louisville Public Health.
So I'm on both, faculty on both, so enjoy that role. I get to work with a lot of great faculty and students, mentor students, help with data and research as well too, and so it's a really great combination. I think it benefits both of us as well to really improve health in the city and make us a healthier city.
Okay, Sarah Moyer from the Louisville Metro Department of Public Health and UofL School of Public Health. Thanks for being on the program talking about hepatitis A. Get your hands washed and get your shot, right?
Get your vaccination, yes. Wash those hands.
Steve Furmanek is a biostatistician in infectious diseases at the U of L School of Medicine. I think that means he analyzes a lot of data as it relates to things like the risk of fire in homes with children and what data tells us about hand washing. But he will tell us what his job is and what he does. Welcome, Steve, to the show. Appreciate it.
Thank you, Mark. It's a pleasure to be on.
All right, so what's a biostatistician? What is that?
So a biostatistician handles really any data analysis, specifically for health-related data. So it could be hospital infections, it could be infectious disease rates. Oftentimes we work either for hospital systems or health departments or universities, such as myself. So that's...
To try and use data to make better health decisions and set policy, those kinds of things. So you're sort of the local version of the CDC?
I wouldn't want to overstate my importance, but you could think of it that way.
Okay. All right. Well, you did a couple of papers and studies articles that I was interested in. So we'll talk about those. One is this look at fires in homes with kids and how to figure out where the most likely place there's going to be fires in homes with children, right? Isn't that what you did? All right. Well, tell us about the study.
So originally, this study was meant as part of a program evaluation. So what happened before I had signed on to the project was there was an intervention where it was educational, going to a suburban and an urban hospital, teaching families with either newborns or families that were expecting a child about fire safety. So things like don't microwave a baby bottle, things of that nature.
Put the little covers on the electric.
Put covers on the electrical things.
Okay.
Cook on the stove on the back burners instead of the front
kids
ones.
Can't reach it. All smart
things like that.
Okay.
And so we had a successful intervention. Parents it showed that they were learning and kind of retaining that sort of educational piece. But we wanted to find out how successful we were at reaching, you could say, at-risk parents. So what we did is we performed a literature search to find out what were possible risk factors for home fires or burns among children. So there's potentially lots of ones. So first-time parents, obviously that's a risk factor because they may not have the experience.
That kind of stuff, right?
Yeah, young parents as well. The education level of the parents, race, socioeconomic status, a lot of very many things in public health have sort of similar risk factors to those. But for home fires, we kind of tailored it to that. And we used fire data for residential fires to sort of as our gold standard for seeing how well we did to predict home fires. So what we did is you can use this publicly available data. It's from the census called the American Community Survey. So we were able to identify several risk factors in there. And for the census tract level, which is just a sort of a geographic space that the census defines, we were able to build a model where, depending on how severe your census tract was, we could then sort of predict a total score.
So was this just in Louisville that you did this?
Yes, this was just in
Jefferson County.
Yeah, Louisville, Jefferson County.
So I think what you're saying is you were trying to figure out the likelihood of a kid getting burned in the house in certain parts of Jefferson County. Where's the most likely place in Jefferson County? Am I right?
Yes, that's
okay.
So that's what this all mathematically we combine it all into a big formula and spit out just a total risk score, which then we classified into low, medium, high, and severe risk.
So where do kids in Jefferson County have the biggest risk of getting burned by a fire in their own house?
The largest risk would be in the West End, sort of the north part, kind of like downtown.
Portland area?
Yeah, downtown Portland, potentially old Louisville. That's getting towards the south end of the area. But that's
Is that expected? I mean,
that's so a lot of the houses are older there and potentially are at greater risk of home fires, and also just in terms of the other risk factors, that's where a lot of
Right, the education level of the parents is not as high as it would be out in Prospect or someplace like that. So that's a logical thing to do. So you've got this information. Use this data to figure out what kids are at the most risk of getting burned in their own homes in Louisville. What do you do with it now?
So what we did is specifically was to look at how did our families that participated in the educational intervention, how well, where were they and how well did they match up? And also, there is a risk working with sort of a community level sort of model when applying it to individuals, that it could be that, the families that we have aren't necessarily representative of the places where they live. So also trying to account for that as well. So that's what we found out, that for the most part, our families were in the sort of moderate risk areas, so not necessarily as high risk. But going forward, if we were to prioritize new educational interventions, it would be in those higher risk areas. So,
gotcha. We're talking with Steve Furmanek, who's a biostatistician in infectious diseases at the UofL School of Medicine. And when you use this study and the data from this, is the idea that perhaps in the future that the hospitals and the places that deliver babies in Jefferson County, if they were to do some program, that they should be able to target the parents who walk in based on where they live and say, should we give these parents some extra training and, how to keep fires from happening in their homes?
Yes, that is definitely one possibility.
Okay.
You could also partner with the local fire departments in terms of the fire departments that serve those areas. So there's lots of possible ways that you could use this.
So that's the way to use data to potentially solve a problem.
Yes.
And that's basically what your job is, right?
Yep.
Okay. And one more thing on this. If I'm a parent and I walk into a hospital now, and you may not know the answer to this, it may be a public health question. If I walk into a hospital or go to baby classes, delivery classes, those kinds of things, am I going to get any education on how to keep your house from burning down, or is that not something they even teach? Did you run into that with your families that you surveyed?
I unfortunately don't know the answer to that question.
It is a public health question.
So I came in a little bit after the intervention had occurred. So I would hope that they do. If they don't, it's a fairly simple thing to just hand people some information. So
we're talking with Steve Furmanek, who's a biostatistician in infectious diseases at the UofL School of Medicine. We just got done talking about fires in homes and the predictability of fires in homes with children. Now we're going to talk about a hand hygiene article that you wrote. So let's talk about that, Steve. How'd you get into looking at hand washing?
Well, my mentor from the Division of Infectious Diseases, Dr. Tim Lemkin, he's no longer with the university and is now in St. Louis at Mercy Healthcare, but he was very interested in hospital epidemiology, so tracking hospital-related infections and really trying to minimize those. So from a perspective, there is a risk whenever you come in contact with patients that you could potentially be either contaminating just either equipment or your hands, possibly with infectious just material. So hospitals spend lots of money trying to sterilize and clean equipment, and one of the ways that they could really prevent a lot of infectious diseases is by just making sure that people are washing their hands. There's several points of contact where washing hands is appropriate, and it can cause all sorts of things. If you think about the hepatitis outbreak, the Hep A going on right now, ultimately that comes from a failure to wash hands, but typically from a food service situation. But still possible in a hospital as well. Typically you see more like Clostridium difficile infections or things like that.
C. diff, as we commonly refer to it as.
Yes.
So all right. So we know that not washing your hands, if you're a nurse or whatever, a nurse's aide in a hospital, and you don't wash your hands, you could be carrying disease. All right. So how do we get those nurses and doctors and nurses' aides to remember to keep washing their hands throughout the day?
Well, most hospitals have some sort of infection preventionalist there that will, survey and see how often people are washing their hands. So that's what this we created kind of an open source free application that hopefully if people are interested in using it, they can. So it doesn't require any specialized software. But what it does is that if you're an infection preventionalist, you can you'll do audits where you'll see, okay, let's follow around to this nurse, see how often they're washing their hands. And so then you'll log those into the app. And then what happens is you have what are called process control charts, which when you use the app, it'll aggregate your data and put it in kind of a line chart where you can look at, say, monthly hand washing rates. So ideally you would want 100% hand washing, but the reality is that may not happen. I mean, we're all human, we all make mistakes. So what you can do then is you can look at and say, okay, well, it looks like here we had a big dip in hand washing rates. Maybe we should investigate what's going on. Perhaps we had a lot of new people come in, and so they don't know the standard procedures yet, or things like that.
So this is an app on the phone, basically.
It could be. So what we use Google Forms. So really anything that has an internet connection you could use. Now, potentially you could run into issues where obviously the app does not record protected health information, so there should not be any issues there. But some hospital systems may not, they may want a greater security than's provided there. But since it's free and it's fairly secure, that's what we'd use for it.
Right. Mm-hmm. We're talking to Steve Furmanek, who's a biostatistician in infectious diseases at the UofL School of Medicine. A couple more questions real quick on that. This tracking, is it done just by whoever the infectious disease person is in the hospital, or is this something that each individual nurse, doctor, nurse's aide, every employee in the hospital is logging into to report that they've washed their hands?
So there's potential for both ways. Really, anyone who's set up to monitor it could log it. The issue with self-reporting is that you may not have necessarily people being honest or people being just remembering to log it. So ideally, it would probably come from the infection preventionalist or from other people assisting them. Now, it could be that really you can have multiple logins to the Google form in terms of multiple people accessing it to input data. So in terms of restrictions that way, there's no issue there.
Have you had a chance to test this and see if it works in any hospital?
Well, we have attempted to. Unfortunately, the only data we have so far is simulated. Now, I suspect that Dr. Wemkin, now since he is in Mercy Healthcare, I suspect that he might be interested in trying to run it there.
But if hospitals here in Louisville were interested in doing something like this, they just track you down?
Yeah, definitely. They could contact me about using it.
Okay.
So.
And it presumably would help the disease rates and infection rates in hospitals go down if you've got people more at
that is
top
the goal.
Of mind thinking, oh, yeah, I need to wash my hands. Right?
That is the goal, yes.
Okay. All right. Steve, it's good to talk to you. He's a biostatistician in infectious diseases at the UofL School of Medicine. And for those of you at hospitals, last name is spelled Furmanek, Steve Furmanek, and you can look him up on the UofL webpage if you need to track him down. Steve, thanks for being on the show.
All right,
Appreciate it.
thank you.
Thanks for listening to UofL Today with Mark Hebert. Go Cards!